A demonstration of knee examination. We're going to start with active movements, active extension. Check with your uninjured limb the full normal range of extension. So can we bring your foot towards you and press your knee down into the trolley. And then with the limb you're assessing, bring the foot towards you and press your knee into the trolley. A full extension means there is no meniscal tear blocking the joint. We will then go and try to feel for the end feel of passive extension. So I'm just going to lift your foot and just bend the knee and allow it to drop into your hand. Firm end feel there means there is full passive extension. We're then going to do a straight leg raise and resisted extension. So can you lift your foot up to my hand there, put my hand underneath and don't let me bend your knee. And relax. And that is extension. We'll now test flexion of the knee. Then starting with active flexion. Can you bend your knee up for me and bring your heel up towards your bottom? And that is flexion. If we can do the same with your other knee to see that we have a full range in both limbs, that's fine. Straighten your legs out for me. So that is active flexion. We're then going to try passive flexion, where I want you to please just keep your leg nice and loose, and I'm going to lift your leg and just bring it up towards you. We're then just going to compress the leg to feel a soft end feel and bring the leg back down. And that completes passive flexion. We're then going to do resisted flexion. So we'll bring your knee back up and don't let me straighten your leg. That's perfect. Just relax your leg there. We will now assess passive rotation. So with your leg in this position, your left hand on the knee and your fingers on the tibial condyles, bring your hand over the foot and rest your thumb on the outer edge of the foot and just bring the foot out laterally. Watch the shin rotate and feel the tibial condyles move, and that is lateral rotation. For medial rotation, move your hand down to the outer side of the foot and rotate the knee medially and back. We'll now move on to test the collateral ligaments of the knee, starting with the medial collateral ligament. So with the knee slightly flexed, pop your hand on the opposite side of the knee from the ligament and your right hand on the same side as the ligament. And just support the knee there and stress the ligament, feeling for laxity and checking for pain. For the lateral collateral, simply reverse your hand positions and stress the lateral ligament. And that's the collaterals. We'll now look at the anterior and posterior cruciate ligaments using the draw test. So what I'm going to do is just bend your knee up slightly, and unfortunately I'm going to pop some of my weight onto your foot here. So just support the patient's foot with a bit of counterweight here. Put your hands over the top of the tibial tuberosity, a finger of each hand on the hamstrings that you can feel, and the remaining fingers round the calf muscle. Straighten your elbows and just pull back with good force. You feel it for laxity, and that is the anterior cruciate. For the posterior, keep your left hand where it is. Bring your right palm over the tibial tuberosity and just push backwards. And that's the posterior cruciate. The McMurray's test allows us to expose the surfaces of the knee to each other, and as we compress them, we can feel for locking or clicking, which would be suggestive of a meniscal injury. We do this test with the knee starting in flexion and move into extension. So I'll take my position down here and support the foot with my right hand and the top of the knee here with my left, and we bring the knee up into flexion. And I'm just going to rotate there, in this position, bring the foot laterally and rotate again, and move the foot medially and rotate again. We then slightly extend the knee and repeat the same movement medially, in the midline and laterally. Slightly extend the knee again and repeat those three same movements, keeping the compression with your left hand, extending the knee again in the same three positions until you almost have extension, but not doing this in full extension. Thank you.